Thank you for joining us today for this UN Water Conference side event on integrating neglected tropical diseases and water sanitation and hygiene to accelerate progress on the SDGs. My name is Alicia Altz. I'm with Uniting to Combat NTDs, an international public-private partnership for the NTD community. I'm excited to be sharing this panel with our distinguished speakers on the eve of the 2023 UN Water Conference, which marks the midterm review of the International Decade for Water Action. I'd like to take a moment to thank our event co-organizers from the governments of Germany and Senegal, and all our partners, including Sightsavers, for their cooperation in organizing this panel. The polycrisis, that is, the compounding energy, climate, food security, conflict, and pandemic crises, among others, is setting back more than just the water agenda and SDG 6 on clean water and sanitation. It is also impacting progress across the SDG agenda on health, poverty, education, gender equity, and partnerships. For our water sector listeners, neglected tropical diseases, or NTDs, is an umbrella term used to describe a group of 20 communicable diseases that affect over 1.7 billion people, mainly amongst the most marginalized populations. They prevail among the same populations with the least access to WASH services. NTDs and poor access to WASH contribute to cycles of poverty and disease. This means, however, that progress against certain NTDs can serve as a proxy for equity and effective targeting of WASH programs. We were pleased to see some of the linkages between water and NTDs, especially through the lens of WASH and climate change, made clear in the concept paper issued in the lead-up to the interactive thematic dialogue on water for health, scheduled for the first day of the conference tomorrow. We were also pleased to see different aspects of the universality of human rights highlighted. Now, WASH NTD linkages have been set out in global agendas and policy frameworks. They were set in stone in SDG Target 3.3, which includes NTDs and waterborne diseases, the specific reference to the latter here making clear the importance of WASH in health interventions. Yet, a lack of cross-sectoral coordination, integration, and an interdisciplinary workforce make it difficult to sustain any momentum in collaboration across sectors. This is where this panel comes in. We hope to highlight the synergies that may arise from this cross-sectoral work. We also hope that discussions will highlight the need for funding structures and policy to support integration, as was called for in the 2022 Dakar Declaration. The Water Action Agenda will be the main outcome from this UN Water Conference. It calls for commitments to mobilize action across countries, sectors, and stakeholders to meet global WASH goals and targets. These commitments are meant to be integrated across sectors and aligned with ongoing global processes. I want to therefore take a moment to mention the Kigali Declaration on NTDs, launched last year. It's an ongoing global process mobilizing commitments, which, like the Water Action Agenda, calls for integrated approaches and action from diverse stakeholders to end NTDs by 2030. The declaration also emphasizes putting affected countries and communities front and center. To find out more, please visit our webpage, which will be shared in the chat. Now, without further ado, I'd like to introduce our speakers. They represent a diverse group of stakeholders involved in the complexity of water health interactions. Each has a role to play in WASH NTD integration, and we look forward to sharing these perspectives with you today. First, we have Dr. Michael Klieve, who is Deputy Head of the Division on Pandemic Prevention and Preparedness and One Health at the German Federal Ministry for Economic Cooperation and Development, or BMZ. He has a doctoral degree in mathematics, and over the past 30 years, he's worked in different departments at the ministry and as head of cooperation at the German embassies in Brasilia and Guatemala. Before joining BMZ, he worked in the private sector. Next, we have Dr. Ndeye Mbakia Khan, who is the National NTD Program Coordinator at the Ministry of Health and Social Welfare of the Republic of Senegal. Doctor of Medicine, Dr. Khan has been the coordinator of the NTD program since September 2020. She is a specialist in public health and has a master's degree in medical biostatistics and epidemiology. Dr. Khan's diverse experience includes working at the district and regional levels, coordinating regional task forces and programs on communicable diseases, and research on various health issues, including rabies. Next, we have Dr. Ibrahima Sosefal, who is the new director of the World Health Organization's Global Neglected Tropical Diseases Program. Dr. Sosefal, as he is universally known, was trained as a military physician and has over 30 years of experience in medical practice and public health. He is a public health scholar, global health leader, and infectious diseases epidemiologist. He served as Assistant Director General in charge of the WHO's emergency response between 2019 and 2022. During this term, he led the organization's response to high-impact epidemics, humanitarian crises, and acute public health events at the global level. Previously, he worked as Regional Emergency Director in the WHO's Africa region and was the WHO representative in Mali, during which time he had also been appointed by the UN Secretary General as Ebola Crisis Manager and head of the UN Mission for Ebola Emergency Response. Next, we have Mr. Abdul Aziz Faye, who is president of the Poseas Congad Network, or the Platform of Civil Society Organizations for Water and Sanitation in Senegal. He is an engineer in local development and WASH in schools and coordinated the water access program in schools for a decade, and is member of the WASH scientific community of the Southern Inter-Academic Cooperation Zone. Now, finally, our last speaker is Ms. Shomi Hassan Chowdhury, who is an award-winning WASH activist from Bangladesh. She is a development professional with over 10 years of experience in community development and a youth advisory board member of Youth Combating NTDs, a youth-led advocacy coalition working to end NTDs by 2030. Now, before I get started, I just wanted to note that Ms. Chowdhury is actually traveling to the UN Water Conference as we speak, which is wonderful, but unfortunately this means she's not able to join us live. So her responses to her questions will be pre-recorded as you'll see them played back. Now, I'd like to start with the first question to Dr. Glive. Dr. Glive, I'd like to ask you, how can we ensure that marginalized and vulnerable populations have access to the knowledge, resources, and tools they need to protect themselves from NTDs and improve their WASH conditions?
Thank you very much, and good afternoon or good morning to everybody. Neglected tropical diseases, also called NTDs, disproportionately affect disadvantaged people, whether urban or rural. Access to improved water and sanitation, safe wastewater management, and appropriate hygiene practices are important prerequisites for reducing the transmission and spreads of NTDs. Right now, there are still 2.2 billion people living without access to clean drinking water and 4.5 billion people without access to proper sanitation. In these settings, with poor infrastructure and weak government services, many NTDs are transmitted to humans through water. Half of all healthcare facilities worldwide still lack basic hygiene services without water and soap or alcohol-based hand rub. According to the latest joint monitoring program report by WHO and UNICEF, around 3.8 billion people use such facilities, putting them at greater risk of infection. It must be clear that hygiene is a basic requirement for all medical services. But we also require proper sanitary facilities at schools, particularly for girls. Improving hygienic conditions in schools not only reduces the burden of NTDs among children, but has also a catalytic effect for raising awareness and improving hygiene in the entire community. We should remember that gender equity is key to many of our global challenges. Women and girls are often among the most affected by NTDs. They bear the largest burden of their consequences due to socio-economic factors and stigmatization. And at the same time, they have the least access to medical attention. Women often act as caregivers and educators in their communities to prevent, treat, and raise awareness for NTDs. And they often do the lion's share of household activities, dealing with children, food, animals, water, and hygiene. Thus, women are key players for fighting against NTDs. The German government recognizes the critical position of women in the fight against NTDs. Just this month, the German Federal Ministry for Economic Cooperation and Development has launched its new feminist development strategy. It highlights our dedication to eliminate structural inequalities, unequal treatment, and discrimination. More concretely, our ministry intends that over 90% of all new projects will contribute directly or indirectly to achieving gender equity. Thank you.
Thank you, Dr. Glieve, and very important to mention the gendered aspects of WASH and NTD interventions, so thank you. Dr. Khan, this next question is for you. I'd like to ask you, how are WASH NTD interventions jointly implemented in Senegal? And in what ways can WASH interventions be better integrated with NTD control and elimination programs to achieve more sustainable and equitable outcomes?
Donc, merci. Bonjour, chers modérateurs et honorables participants. Il m'est particulièrement agréable de participer à ce panel de haut niveau avec un thème si important et à une étape cruciale de l'accélération de l'élimination des MTN d'ici 2030. Je me réjouis aussi de co-animer ce panel avec Dr. Sosefal, Dr. Michael, M. Abdelaziz Faye, Mademoiselle Choumi, que j'adresse mes chaleureuses salutations. Je voudrais aussi remercier Madame Salimata Bokoum et à travers elle Unite Combat NTDs, GIZ, pour l'organisation de ce panel en parallèle à la conférence des Nations Unies.
Deux minutes, s'il vous plaît.
Hello, did you take the French channel to answer? And we could not hear, we could hear the French in the English channel. 2 minutes. This is the interpreter checking. This is the interpreter checking on the English channel. Hello, this is the interpreter. This is the interpreter. Could you please start to speak now? So is that working now? Can you hear me?
All good. Thank you, Paul.
Yeah. Okay, please repeat. Okay, can you hear me? Is that working? Says the speaker. Yes, that's fine. Thank you very much. Please go ahead. So thank you very much. So I would like to say that Senegal and the international community have undertaken to achieve the Sustainable Development Objective for 2030 and to fight NTDs. This is part of the Senegal Energy plan with health plans which are to fight against NTDs. Among the 4 targeted NTDs, these are essentially high WASH interventions to fight against these and to control them and to eliminate them. Interventions relating to water, sanitation and hygiene have been recognized for a long time and have been prioritized in the NTDs, fight against NTDs. Lots of intensification of the approaches in terms of coordination in sectors relating to health and relating to NTDs. The question would be how these are jointly implemented across Senegal, and is this essential to eliminate and control the NTDs? Today, the measures are taken to include WASH in NTD programs in Senegal through collaboration with the WASH sector. Efforts have been undertaken to include WASH in NTD, including poor health conditions and the development of fights against NTDs. This will be achieved when some NTDs, including matters relating to the quality of water, health and sanitation. I would like to talk about cholera as an example, which show the achievements of WASH as an intervention in our program. This contributed to clean water in protected areas. So we put in place a sanitation program which truly contributed to the eradication of the worms in Senegal. And the strategy has been implemented in Senegal over more than 10 years, with the including the cleaning and the improvement of conditions for access to health services. So important efforts have been undertaken for endemic areas through also the raising of awareness. Note also that water and sanitation is also undertaken at a national level in water and sanitation areas in terms of the SDGs, with basic services to an inquiry undertaken in 2017 showed that access to this was important, which contributed to the reduction of NTDs in these areas. In generally, we can say that interventions are showing a return on investment, with each dollar invested in WASH sectors with a return of $1.5 in terms of NTDs. We put in place in Senegal a national platform for more harmony in interventions, and this platform was created in 2017. Other benefits are the integration of WASH in terms of the social action minister. In 2017, we put in place a commission responsible for WASH, developed an action plan to in terms of responses relating to WASH in the national strategy for Senegal, and also the integration of WASH data in the health data platform. So today, note that essentially to guarantee the integration of WASH in NTDs amongst teams fighting against NTDs, collaboration, coordination across the country, planning proactively in terms of interventions, sharing data, and finally, the establishment of epidemiological data relating to WASH response is important today to develop synergy in actions and the implementations of effective coordination mechanisms across the sectors at appropriate levels, which respond clearly to the roles and responsibilities of the ministers concerned. Furthermore, it is crucial to professionalize advocacy for WASH with a better care of water and health contributions by health sectors, public and private sectors, and promoting changes in behaviors by encouraging WASH behaviors, as well as clearing and mass campaigns against NTDs. Thank you very much.
Thank you, Dr. Khan, and apologies on our interpretation difficulties. If I could just ask our French speakers to take a bit more time when speaking so our interpreters can catch up. We'd appreciate that very much. But thank you for sharing those very important points and some great examples on the ground as well. So the next question is to Dr. Sosefal. Dr. Sosefal, I'd like to ask you, what contributions can integration of WASH and NTDs make to the wider global health agenda, especially in times of global crisis?
Thank you very much. Can you hear me?
Yes.
Good morning, good afternoon, and good evening. I know you have many people connected from all over the world. It's my pleasure really to join this very important panel with colleagues, but also, training United to Combat NTDs and GDZ. And it was a pleasure to hear Mark speaking from Senegal about Guinea worms, because 30 years ago, I was there combating Guinea worm, and the last case was recorded in 1998 on the final certification 2004. And we are talking about a very important topic, integration. And we always talk about integration, but why do we need to integrate when we talk about NTDs and WASH? We can take it from various angles. If you talk about health determinants, water, sanitation, and hygiene are determinants of so many types of diseases, starting with NTDs. If you look at also health emergencies and outbreak, you have so many diseases that are linked to water, like cholera, like typhoid fever, and other diarrheal diseases like Shigella and others. And so if you take also the people-centered approach, you have the same people affected by NTDs and also other waterborne diseases. So it's really important to make sure that we are not fragmented, since you are addressing issues affecting the same population. You have the same health workers managing the same different programs. So it's very important to make sure that we address the issue together in a more efficient manner. So my third criteria is really about efficiency. Why should we address one health problem today? Tomorrow we go back to the same population to address another health problem, where we can put resources together to be more efficient. And the fourth argument is really about greater impact, because if we integrate our effort with NTDs and WASH, the impact will be greater. The impact will not only on individual NTDs or individual waterborne diseases, but will have great impact in so many other diseases. I talked about cholera, typhoid fever, Shigella, and others, but also in terms of addressing antimicrobial resistance, because we are nosocomial transmission of diseases. So the infection prevention and control in health facilities is extremely important. And you heard Dr. Grover talking about health facilities that have access to water and sanitation, and this is the main causes of nosocomial transmission of infectious diseases. So I think it's very important, from all sides, when we start planning, we think about, planning together, putting resources together for greater impact. And when you take the global crisis, if you look at last year, the world had to provide support to over 330 million people in need of humanitarian assistance. Before the COVID-19 pandemic, we were talking about less than 200 people, in need of humanitarian assistance. So now, with more than 330 million people affected by humanitarian crisis, the risk of NTDs has increased, the risk of other waterborne diseases has increased. So making sure that when we plan for humanitarian, intervention, we take into account the NTDs, take into account the other waterborne diseases, is extremely important for more prevention and to prevent unnecessary death and excess mortality. Thank you.
Wonderful. Thank you, Dr. Sosefal. And yes, thank you also for mentioning the importance of the humanitarian response and integration, especially as we think about the tropical cyclone affecting people in Malawi and Mozambique as recent as last week. So Dr. Faye, the next question is for you. I'd like to ask you, how is POSEAS involved with the Ministry of Health and Work that synergizes SDGs 3 and 6, in particular with WASH and NTDs? And you might just have to unmute, please. Thank you.
Okay, can you hear me? Okay, thank you very much. I would like to greet all of the participants of this high-level panel I would also like to thank and greet Dr. Michael Graver, Dr. Sosifal, and the moderator, Alicia, and all the participants on this panel. I would like to state that achieving SDGs is a key message for actors. Coordination of WASH activities is difficult because there are different state actors, the ministries of health and social activities, the Ministry for Water and Sanitation, and the NGOs, and so on. And each organization has their own coordination model. For example, in 2021, there was a national committee put in place, a multi-sectoral group to combat NTDs and the WASH sector. So for non-state players, the UN platform process is a major platform for these subjects in Senegal, where it unites various members to take part in the fight against NTDs and WASH actions to increase sustainable services in terms of sanitation and WASH, to act on prevention and the fight and elimination of NTDs. This process through activities with the Ministry of Water and Sanitation, the Environment and Health, and NGOs acting in this sector has made a significant impact in the fight against lots of neglected tropical diseases. These are considered as part of this strategy. Senegal has developed a national strategy to improve the quality of drinking water, to contribute a sustainable response at a national level to the significant challenges of access to drinking water. These are through synergies of action, through the work of 75 NGO members who have contributed to WASH with the Ministry of Sanitation. We're working in vulnerable areas to ensure access to drinking water. Also, this has contributed important information to the preparation for the elimination through the Accelerate project across a dozen African countries, including Senegal, to accelerate interventions as part of the fight against trachoma. And what is more, the process with actors in the sector has worked on a project which has focused on a sectoral strategy and policies in this subject and the capacities of the different actors involved. Furthermore, since 2010, the United Nations has adopted access to water and sanitation as a human right. This is part of this dynamic that a guide was developed focusing on human rights through water and sanitation with sectoral players, the Ministry of Health, the Ministry for Water, the Ministry for Sanitation, and so on, along with technical and financial partners, the ministries responsible for finance and the environment. The question which we should need to ask ourselves today is to understand whether 2030 will mark the end of suffering arising from NTDs. Let's be optimistic. There are many challenges. Some of these challenges could be linked to the consequences of conflicts, of threats and emerging threats to health, as well as social inequalities, which have a direct impact on access to health services, to drinking water and sanitation. Thank you very much.
Thank you, Mr. Faye. some great examples of synergies of action delivered through communities. Now, I'll go on to this question from Ms. Chowdley, who attended the Conference of Youth on the sidelines of COP last year and addressed NTDs in a workshop. I asked her if she could share a bit about why integration of WASH NTD interventions is so important in the context of climate change, and what role WASH has played in climate-related disasters in relation to NTDs. Here's what she said.
Thank you, Alicia, for that question. Yes, exactly. The main objective behind my participation there was to highlight the key linkages between NTDs and climate change. The achievement of the Sustainable Development Goals related to health is being impeded by different factors such as climate change, conflict, migration, and COVID-19. And these factors create conditions that increase the likelihood of the neglected tropical diseases. In particular, climate change impacts the spread and distribution of diseases, placing impoverished communities in new areas at risk. Climate-related calamities such as floods in Pakistan have been linked to a rise in the prevalence of diseases, including NTDs such as dengue, whereas usually it is diseases like cholera. The recent monsoon season in Asia affected more than 42 million people, severely hit by floods, landslides, and torrential rains, and has put them at risk of diseases commonly associated with disasters, including dengue. And this number only reflects records from a few countries in the region. So it is clear that climate change has a significant impact on the availability of safe drinking water, sanitation, and hygiene, or WASH. And severe weather events such as floods and hurricanes can have adverse effects on WASH systems, which are crucial for preventing and managing the NTDs. Adequate sanitation is essential in reducing the risk of contracting various illnesses, while access to clean water and hygienic condition in both healthcare facilities and households are crucial for treating and caring for many NTDs. My organization, Awareness 360, is currently assisting the Rohingya refugee population on the southernmost island of Bangladesh, which is also one of the country's most climate vulnerable regions. These communities face devastating losses due to climate-related events such as river erosion, and they lack access to clean water and proper sanitation, making them more susceptible to the neglected tropical diseases. Therefore, implementing interventions that combine WASH and NTD prevention is crucial in addressing the impact of climate change on these vulnerable communities. It is essential to ensure that water, sanitation, and hygiene services are adaptable, safe, secure, and resilient. Insufficient rainfall can lead to low water availability and depletion of water sources like boreholes and springs, while heavy rains and flooding can harm water and sanitation facilities, leading to water contamination. The increase in water costs caused by climate change-induced water scarcity can create inequitable access to safe water, depriving households of proper hand washing and hygiene, and negatively impacting children's health. To address these challenges, it is necessary to identify the climate threats to infrastructure, services, and communities, and implement climate-ready WASH programs. Such programs may include modifying infrastructure designs, raising community awareness about climate change, and promoting water conservation practices, as well as promoting renewable energy. As both NTDs and climate change disproportionately affect impoverished communities, integrating WASH and NTD prevention in the context of climate change can have a multifaceted impact. Thank you.
Wonderful. Now our next question is for Dr. Fall, Dr. Sosifal. I'd like to ask you, how does the WHO support the scaling of integrated interventions into global policies? And what are the political and institutional challenges to doing so?
Thank you very much. This is a very important question. From the NTD side, we have developed, as you know, the roadmap for 2030 with a number of targets. This roadmap, endorsed by countries and partners, we are proposing a number of strategy shifts. The first one is, moving from measuring process to measuring impact. The second one is more about horizontal programming and cross-sector collaboration, raising the issue of integration we are talking about. And another shift is about really moving from partner-driven to country-driven programming.
Apologies, I think we've lost Dr. Fall at the minute, so let's just double check. The connection seemed to go off, so maybe what we could do is move on to our next speaker, Alicia, and then return hopefully shortly. Thank you.
Certainly, we can do that. So this next question then is for Dr. Glive. Dr. Glive, I'd like to ask you, how can we ensure that global governance structures and policies related to health and development take into account the linkages between NTDs and WASH? And how can we build a more coordinated and effective response to these issues?
Yes, thank you. The German government has been supporting the prevention and control of NTDs for decades, primarily by strengthening national health systems and research capacities. However, our 2021 One Health strategy has now firmly embedded intersectoral cooperation and a more holistic approach in our fight against NTDs. Applying a One Health approach recognizes the interlinkage of human health, animal health, and ecosystems, including water. This One Health approach is an integral part of the WHO Roadmap 2030 to end the neglect of NTDs. The German government fully supports this roadmap and has been the first donor country signing up to the Kigali Declaration. Concerning the international health architecture, we are moving into the right direction. The closer cooperation of the quadripartite organizations, namely the Food and Agriculture Organization, FAO, the United Nations Environmental Program, UNEP, the WHO, and the World Organization for Animal Health, WOA, as well as the establishment of the One Health high-level expert panel are a great step forward, leading to a better international intersectoral collaboration in this field. But apart from global coordination mechanisms, we need to put the One Health approach into action. To include communities effectively, it is important to raise awareness and foster education initiatives on hygienic practices, disease transmission patterns between animals and humans, measures for NTD prevention, and measures safeguarding the environment. Also, cooperation with civil society on WASH, health, and agriculture needs to be intensified. We have taken up those points and we will make stronger efforts in our development cooperation for strengthened health projects, social protection systems, improved prevention of infectious diseases, and equal access to vaccines, therapeutics, and diagnostics against NTDs. All of this requires a concerted effort. The issue of NTDs and neglected communities needs to be put back high on the political agenda. We not only need to strengthen key multilateral partners in their effort, but we need a new, genuine partnership with NTD endemic countries. Thank you.
Wonderful. Thank you, Dr. Glive. And of course, very important to mention the One Health approach. We couldn't go through this webinar without doing so. So thank you. I believe we'll move on while we wait for maybe a connection to reestablish for Dr. Fall. So the next question is for Dr. Khan. Dr. Fall is back. Okay. Would you like to continue where you left off, Dr. Fall, on the question of...
I don't know at what point I was frozen.
Of course.
So I was saying, we have a number of platforms for integration. So I talked about the One Health platform, where we bring animal health, human health, environment, agriculture, and so on. We also have, the health security platform, to prevent and to respond to outbreak. But we have key capacities there, like the IPC, infection prevention and control, that are important for NTDs. But also, the integration of NTDs and WASH will also help to prevent, antimicrobial resistance. And this is another platform also we have. And the main challenge we have really is related to the fragmentation of the global health architecture and global funding mechanisms. Because we have global fund for HIV, TB, and malaria, we have the global pandemic preparedness funds, but we don't have any coordinated fund for NTDs, making sure that we can use this existing funding mechanism to be more cost-effective and more efficient at community level is a way to go on. I think, moving forward, looking at additional challenges we have, like climate change, many participants are raising also, but the risk of pandemics that can disrupt the health system, but also the economic system. We will be stronger if we plan together and if we put resources together in the One Health approach. Thank you.
Wonderful. Thank you, Dr. Full, and great to hear about the different platforms WHO uses to support integration. So we'll move on now to Dr. Khan. Dr. Khan, I'd like to ask you, after hosting the World Water Forum in Dakar last year, how do you see WASH NTD integration addressing some of the key messages agreed in the Dakar Declaration? And how does this relate to the Water Action Agenda?
So, thank you. I would like to come back to this World Water Forum that was held last year in Dakar in March. After this forum, we had the Blue Deal, which was developed, and in the WHO World Roadmap for NTDs, which was focusing on increased access to safe water and sanitation objectives. Goal 6 was focusing on the elimination of NTDs. This was reaffirmed in the Dakar Declaration with a strong commitment to implement the SDGs. I would like to state that the NTDs are closely linked to this, particularly SDG 6, which talks about access to water and sanitation. The Sustainable Development Goals are ensured to seeking to achieve NTDs with successful fight against NTDs, which will contribute to other SDGs as well. There is a close link between NTDs and SDGs 1, 5, 8, 9, 10, and 13, which were reflected in the following Blue Deal messages. The first messages was message 2 on improving livelihoods and eradicating poverty, which is SDG 1. Message 7, which speaks of resilience to climate change, demographic health, food, and water stress, which requires the ability of water in quality and in quantity to ensure the health of populations, sustainability of ecosystems, and inclusive growth. And I think a panelist has spoke about climate change, and note that there was an example given which it's important to consider resilience when faced with climate change. Message 8 speaks about the reduction of inequalities, to opening up opportunities for young people and women to promote development and generate employment. Message 21 relates to socio-economic development. Message 23, which is the last message which we were able to align with Objective 13, which was on innovation and infrastructure. So this declaration underlined the need to develop the One Health approach, which I would like to recall remains a strategy to fight against NTDs and is very effective for the fight against NTDs. In terms of the Water Action Plan, the Water Action Agenda, I would like to state that this ensures the continuity of water supply and quality, the access to and use of sanitation, and adequate personal hygiene to reduce the burden of NTDs with sanitation services to the most difficult to reach population groups, with universality and implementation of innovative actions to achieve universal access to safe sanitation and quality water. There is the implementation of the following programs with the follow-up of commitments made during the Water Forum, the Blue Deal, which will contribute to the elimination of NTDs. These are the sanitation program for the Bay of Han, undertaken by the National Sanitation Bureau, the National Water Quality Program, the Rural Water and Sanitation Project piloted by the Ministry of Water and Sanitation with the installation of 100,000 latrines, the Housing and Living Environment Program, in particular the National Hygiene Service, through its missions to disinfect, desanitize and de-rat premises or homes, to fight against open defecation and the effects related to insalubrity. So the key message is health for all cannot be achieved without a WASH for all sector. So health for all cannot be achieved without a WASH for all sector. Thank you very much for your attention. Thank you.
Thank you, Dr. Khan. And wonderful to hear housing mentioned as well in the housing program, just another sector to bring into the complexity as we talk about this. So now we have a question from Ms. Childley. I asked her, how are youth combating NTDs working with WASH sector partners to advocate for integration between sectors? So let's hear what she has to say.
From the beginning, Youth Combating NTDs has emphasized the importance of incorporating WASH into its activities. As a WASH activist myself, my inclusion in the Youth Advisory Board demonstrates this very commitment. During a board meeting in Johannesburg last year, we discussed our theory of change and identified key WASH partners for future engagement. We have partnered with organizations like WHO, Awareness 360, and many more, and have participated in important conversations like the World Water Week to promote the integration of WASH and NTDs. To raise awareness, we have organized storytelling festivals where young people from around the world were able to showcase their creativity through art and other media, highlighting issues related to WASH, NTDs, climate change, and others. Youth Combating NTDs also, in fact, supported my participation in the Conference of Youth event alongside COP27 in Egypt last year. And our organization plans to empower young leaders as NTD champions while also increasing their water and climate literacy. Thank you.
Wonderful to hear from Shomi there. And I do know that the UN Water Conference has been making a particular effort to support youth participation as well. Now our last question is for Dr. Faye. And the question is, some key principles and commitments to the Water Action Agenda are innovation, scalability, and replicability. So could you share an example reflecting these principles and also speak about community participation there?
Merci beaucoup.
Thank you very much. Thank you. I would like to say that access to drinking water for all is one of the priorities for investment in human capital development. To answer this challenge, the implementation of the Water, Hygiene and Sanitation Sector Program is being intensified to improve access to drinking water for all. And the ambition is to increase the financing of rural water from 2% actually to 7% of the national budget by 2030. To do that, the water programs are focused on the densification of water networks, development of access through the creation of new water connections to homes, and rehabilitation. Also, it will be possible to provide multi-village drinking water systems through boreholes with human-powered pumps and the reinforcement of access in difficult areas. In terms of village hydraulics, this is to ensure continued growth of access to drinking water throughout the country to achieve a geographical coverage rate of 100% and access rate of more than 98% by 2030. In terms of urban water supply. The aim is to achieve a 100% drinking water supply in the 14 regions. The expected results are considerable progress towards the achievement of SDG 6.1, even if it would be difficult to achieve optimum and secure access to drinking water services by 2030. Indeed, Senegal's population is predominantly rural and distributed over a vast territory, which implies a very high demographic growth rate, a high cost of infrastructure, and very complex challenges. Improving access to drinking water services will make it possible to eradicate diarrheal diseases and take good care of WASH issues. Furthermore, in terms of the SDGs, the action program should systematize water security and sanitation approach promoted by the Ministry of Water and Sanitation. According to the report of the Water Security Study carried out by the World Bank in 2021, Senegal is already facing water stress, and current water withdrawals are expected to increase by 30 to 60% by 2035. Water-related extreme events and pollution currently cost Senegal more than 10% of GDP each year. In this context, security of access to water remains a permanent concern. Due to the demographic explosion and economic development. So Senegal, as a partner with the WHO, has focused on security, water security in development. So water security for peace. The Water Sanitation Peace Nexus has involved a significant increase in the awareness of water actors. Following the Dakar Declaration for Peace and Development that was produced by the different stakeholders in the Dakar Declaration. This is how post-CS is implementing the Water Sanitation Peace Nexus to respond to recurrent health and security crises, has therefore developed what we call this scheme through consultation and dialogue to develop the platform for an interactive dialogue with communities. In other words, through an interactive discussion between the members of the community, as well as the Blue Guide on Sanitation. So thank you very much.
Thank you, Mr. Faye. Now for this last question, we are running short on time, but I invite all our panelists to turn their videos on. And if you could just give a brief 30-second response, we'd really appreciate that. So the question is, we've exchanged lots of ideas now across sectors. So I'd like to ask you, based on what was shared today, what is the one key message you'd like to share to help translate these ideas into actions in about 30 seconds or less? Dr. Gliva, I'll start with you.
Thank you very much. In these times, the world is addressing multiple crises at the same time. But resilient systems can only be created when there is a strong political will and a dedication to address challenges holistically. Joining forces between the water sector and the NTD community from a local to the global level is part of the solution, in our opinion. Thank you very much.
You are muted.
Thank you, Dr. Fall. Dr. Khan, your final key message.
Thank you. I would like to say that health governance using a multi-party approach, which is inclusive, innovative, and a policy based on knowledge is key to improve water security and to achieve the objectives to eliminate and get rid of NTDs. So, to have health for all, we need a WASH sector for everybody. Thank you very much.
Thank you, Dr. Khan. Over to you, Dr. Sosifal.
Thank you very much. Just to remind everybody that, and policymakers, that we only have one planet, and we all have the health development affecting the entire population. When we talk about 1.6 billion people affected by NTDs or at risk for NTDs, 1 billion people at risk for cholera, we are talking about the same population. When we talk about people at risk for malaria, people at risk for NTDs, we are talking about the same population. So we need to find a smarter way to plan and to allocate resources for greater impacts. So making sure that also health is integrated into our policy for more sustainable financing will be important for NTDs and all global health priorities. Thank you.
Thank you, Dr. Sosifal. And Mr. Fai, please, would you like to share your final quick thoughts?
Absolutely, yes. I would like to say that water and sanitation services must be based on human rights. Privatization, marketization, or financialization of water and sanitation services is a risk for the realization of human rights and should not be considered in the development of global, national, or local policy and international cooperation. So we should endorse the Declaration on Water Security for Peace and Development and contribute to the implementation of the Dakar Forum. Thank you very much.
Thank you, Dr. Fai. And now we'll just hear a quick final thought from Ms. Chowdhury to close up.
Our progress on water-related goals and targets remains alarmingly off track. So my final message for all stakeholders attending today's event would be to prioritize WASH and NTD elimination in their policies and programs. Engage young people as an active collaborator from planning to implementation of your interventions in order to achieve our shared goals. Thank you.
Wonderful. And thanks to Ms. Chowdhury as well for sharing her final thoughts. Now, we are running just a bit over time, so I apologize. We're not going to have time to reach any of our questions, although I do see a lot have come in. But I just wanted to take a moment to thank all the speakers and those participating from around the world in this discussion. It's been a really good session. We've had a range of diverse perspectives from the community to the global level. And it's very clear, of course, that the integration of WASH and NTDs is imperative if we're to reach SDG goals 6 and 3, as well as many others, especially in the face of the climate challenges, which was, I think, a key theme that came out today as well. So the question for everyone attending is what we can do in our own capacity to advance the integration of WASH and NTD programs at various levels. If we don't work together, we will not reach the targets set by the WHO roadmap and the SDGs. But we do need to be 100% committed to ending NTDs and ensuring WASH services reach all. So I do hope that these discussions continue in the following days of the UN Water Conference and that you bring these ideas to your discussions there, especially at the Water for Health dialogue tomorrow. But in the meantime, thanks again to all our speakers. Thanks for those who dialed in, and have a wonderful rest of your day.
Merci beaucoup.
Merci beaucoup. Thank you.
Thank you, Alicia. So on behalf of the NYT and the Uniting to Combat events team, it's been our pleasure to support you today. So thank you again to all of our speakers and to everyone for joining us. Thank you very much.